Good morning. Thank you for joining Alabama Medicaid's public comment session for serious mental illness, 1115 Waiver Demonstration. My name is Melanie Cleveland, Director of Communications, and I now call this public forum to order. The purpose of today's forum is to provide feedback on the progress of the SMI 1115 demonstration. Today's forum is being recorded. I would like to introduce our speaker today, Tiffany Green, Behavioral Health Program Manager of the Alabama Medicaid Agency, who will give a brief presentation. As we get started, I have some housekeeping items to go over. All virtual participants are placed on mute. Please do not unmute your phone or microphone during the presentation to avoid disrupting the presenter. Virtual participants have the opportunity to make comments at any time in the chat box through WebEx. Phone participants may type comments and submit them through email. The email address is publiccomment, publiccomment, @medicaid.alabama.gov. All comments will be posted to the agency website at www.medicaid.alabama.gov. Please record your attendance by entering your name and the organization that you're with in the chat box at this time. If you've joined by phone, please email your attendance by publiccomment@medicaid.alabama.gov to provide this information. I will now turn it over to Tiffany Green for the presentation.
On May 20th, 2022, the Alabama Medicaid Agency received CMS's approval regarding the state's application for the 1115 demonstration entitled Serious Mental Illness. The state acknowledged the award and accepted the special terms and conditions to operate this demonstration concurrent with the 1115 waiver project number 11W00371/4, serious mental illness. CMS's approval of this section 1115A demonstration is subject to the limitations specified in the attached expenditure authorities, special terms and conditions, and any supplemental attachments defining the nature, character, and extent of federal involvement in this project. The state may deviate from the Medicaid state plan requirements only to the extent those requirements have been specifically listed as not applicable to expenditures authorized under the demonstration. As requested by the state, this demonstration will authorize federal financial participation for services provided to Medicaid beneficiaries during short-term stays for acute care in psychiatric hospitals that qualify as institutions for mental diseases in Baldwin and Mobile counties for Medicaid-eligible individuals ages 21 through 64 diagnosed with SMI. Reimbursement is limited to services provided to individuals in IMDs located in these two counties based on the state's assessment of its needs. However, Medicaid enrollees in need of inpatient behavioral health services will be eligible to access services through the IMDs participating in the demonstration regardless of their county of residence. During the demonstration period, the state seeks to achieve the following goals. Number one, reduce utilization and lengths of stay in emergency departments among Medicaid beneficiaries with SMI while awaiting mental health treatment in specialized settings. Number two, reduce preventable readmissions to acute care hospitals and residential settings. Number three, improve availability of crisis stabilization services, including services made available through call centers and mobile crisis units, intensive outpatient services, as well as services provided during acute short-term stays in residential crisis stabilization programs, psychiatric hospitals, and residential treatment settings throughout the state, participating counties. Number four, improve access to community-based services to address the chronic mental health care needs of beneficiaries with SMI, including through increased integration of primary and behavioral health care. And last but certainly not least, number 5, improve care coordination, especially progression of care in the community following episodes of acute care in hospitals and residential treatment facilities. CMS's approval of this demonstration project is conditioned upon compliance with the expenditure authorities and the FTCs defining the nature, character, and extent of anticipated federal involvement in the demonstration. Thank you.
Thank you, Tiffany. All attendees, please be sure that you record your attendance today. You can type your name in the chat box of the WebEx if you've joined virtually. If you've joined by phone, you can email your attendance to publiccomment@medicaid.alabama.gov. And we will now begin the comment segment of the public forum. As a reminder, you can send comments by email to publiccomment@medicaid.alabama.gov. You can also submit your comments in the chat box. So we will now have a brief moment of silence while we wait for those comments to come in. Just a reminder, if you'd like to include any comments for this waiver, you can do so now. Just type them in the chat box, or you can also comment by emailing public comment, public comment@medicaid.alabama.gov. We'll give you a few more minutes just to give you a chance to type, and then we'll close out the meeting if there's no comments. Thank you. Okay, we thank you for your time today. Excuse me, no comments have been submitted in the chat box and nothing has come into the email. So we will now close this public forum. Thank you again for your attendance and have a great morning.